What's up, ladies and gentlemen? Welcome back to NeuroSketch with Dr. Kenny. Welcome to the discussion of the intrinsic muscles of the shoulder, the muscles that stabilize the shoulder joint by keeping the head of the humerus exactly where it needs to be. So we call them the intrinsic muscles of the shoulder region because for sure we have the extrinsic muscles, and we've seen we're discussing the muscles of the back. So we have the extrinsic muscles of the shoulder region. These muscles are originating somewhere and then they are inserting in the shoulder region, so, the scapula and the humerus. And then we have the intrinsic muscles of the shoulder that are originating from the shoulder and they are inserting into the shoulder. So the extrinsic muscles, as we discussed the other time, we said we have the the posterior, we call them the posterior axioappendicular muscles, and we divided them in two groups: the superficial groups with the trapezius and latissimus dorsi muscle, and the deep group with levator scapulae and the rhomboid major and minor muscle. So intrinsic shoulder muscles, we call them the scapulohumeral muscles because these muscles, they form a joint. They are spanning between the scapula and the humerus. And what are these? So these are the deltoid, the supraspinatus, the infraspinatus, subscapularis, teres major, and the teres minor muscle. We're going to discuss each one in turn, and so let's start with the deltoid muscle. The deltoid. So the way that the deltoid comes from two words: delt, which means delta, and oid, which means like. So the deltoid muscle is the delta, like triangular like muscle. This is the most superficial muscle of the shoulder, and it forms the bulkiness of the shoulder at the back. So the shoulder is this big because of the presence of the of this muscle, which is the deltoid muscle. So the deltoid muscle has got different fibers with different arrangement, and we're going to discuss each one in turn. So we have the fibers that are mostly anterior. We call them the anterior fiber, and these anterior fiber, they are originating from the lateral third of the clavicle, and so we call them the clavicular fibers. The clavicular fibers of the deltoid muscle. We have another group of muscular fibers that are found they are called intermediate fibers. The intermediate fibers are originating from the the acromion process of the scapula, and so we call these fibers as the acromial fibers. Okay, let's turn posterior and see. This is also a deltoid muscle, but this is the posterior fiber. But you can see the posterior fiber is originating from the spinous process of the scapula, so we call them the spinal fibers. Okay, let's now correct the origin, collect together the origin of the deltoid muscle. So the deltoid muscle has the point of origin, and depending on where these muscular fibers are originating. For example, the anterior fiber, the clavicular fiber, is coming from the lateral third of the clavicle. Okay, that's no wonder. And then the intermediate part, the intermediate fiber, the acromion fiber, they're coming from the acromion process of the scapula. And then and then the posterior fibers, they are coming from the spine of the scapula, But all these muscle, all these fibers, they converge to form a single muscle, a single deltoid muscle, which is going to insert itself on the deltoid tuberosity of the humerus. This is the deltoid tuberosity of the humerus, and this is the point of insertion of the deltoid muscle. All right, so the nerve that supply the deltoid muscle is known as the axillary nerve. So we discussed the origin of this nerve while discussing the the brachial plexus. But for the time being, let's discuss the action of the deltoid muscle. So every time you see the muscle is forming it's having different fibers, and the movements of the muscle will be complicated for sure. Okay, so it's not like a single movement. So we have different movements of the deltoid muscle, because we have different fiber arrangement of the deltoid muscle. So number one, starting with the anterior fiber, the clavicular fibers. When they contract the clavicular fiber, they will flex, like pull the arm anteriorly, like in flexion of the arm at the shoulder joint. But also because it inserts on the posterior lateral surface, when this fiber contract, they will result also into medial rotation of the arm. So flexion and the medial rotation is by the anterior fibers, the clavicular fibers. All right, so the intermediate group, the acromial group, when it contracts, you see, this is the acromial group. When it contracts, it pull the arm in this direction as in abduct. So abduction of the arm is by the intermediate fiber. But bear in mind, like the deltoid is taking the abduction function from the 15 degrees all the way to 90 degrees. The deltoid muscle abducts the shoulder joint, the arm at the shoulder joint, from 15 degrees to 90 degrees. Means there is the muscle that initiates this abduction, and we're going to see it soon, which is supraspinatus muscle. But the deltoid muscle, it takes over abduction from 15 degrees to 90 degrees. All right, okay. So, and then we'll have these posterior fibers, the spinal fibers. Once they contract, number one, you pull the arm posteriorly, which is the extension, and then because it inserts on the lateral side here, it will like also laterally rotate the arm at the shoulder joint. Rotate the arm at the shoulder joint. Okay. So deep within the deltoid muscle passes by the axillary nerve. So the axillary nerve passes undercover of the deltoid muscle, and guess what? It wraps around the surgical neck of the humerus. So fracture of the surgical neck of the humerus will also mean damage the axillary nerve. Okay. The deltoid muscle is also a site of intramuscular injection. Okay, every time you see someone is injecting a medication at the shoulder joint, at the shoulder region, it is the deltoid muscle which is being targeted. Okay, the deltoid muscle is the one which is being targeted when someone is injecting medication at the shoulder region. Okay. Yeah, so it's also important to bear in mind the relationship between the axillary nerve and the surgical neck of the humerus, because you tend to avoid the region around the surgical neck of the humerus because you can damage the axillary nerve. So this is the injection site. How are we going to determine the injection site? The surgical neck is almost 7 centimeters below the acromion process of the clavicle. So 7 centimeters below the acromion process is where you can find the surgical neck, and so that's the axillary nerve. So you tend to avoid this region. So what happens, you can just take 2 to 3 fingers below the acromion process, and then you inject your medication, so which is typically around 2.5 centimeters to 2.5 to 5 centimeters below the acromion process of the clavicle. All right, so fracture of the shoulder, fracture of the humerus, the shoulder humerus, will also result into damage of axillary nerve. Okay, and then when you have damage to the axillary nerve, means the deltoid muscle is not innervated. Okay, so if we have lack of innervation, the muscle will undergo atrophy, and we call it the denervation atrophy. Remember the elements of myology we discussed about the denervation atrophy. Okay, so it will also the patient will have loss of the barkiness of the deltoid, or the barkiness of the shoulder region, which was contributed by the deltoid muscle, and so it gives an impression of the flat shoulder, and so sometimes this is known as a flat shoulder situation, or the flat shoulder condition. So we have like a hollow, a slight hollow just below the acromion process of the scapula. All right, but also the axillary nerve will also give a branch that is going to supply the skin around the shoulder region. This gray painted area is where the axillary nerve supplies the cutaneous branch of the axillary nerve. And so when you have the damage of the axillary nerve, we will also result into loss of sensation of that region, But if someone has also got an a dislocation of the shoulder joint, it will also result into damage. Can sometimes damage the axillary nerve, and so we have loss of function of the deltoid muscle. So what happens in terms of movement? A patient will not be able, a client will not be able to abduct the arm beyond 15 degrees. Why beyond 15 degrees? Because we have said we have another muscle which is initiating the abduction, and then the deltoid would take over from 15 degrees to 90 degrees. And so if you have loss of function of the deltoid muscle, means we cannot abduct beyond 15 degrees. But also we have seen the spinal fibers of the deltoid muscle will also help in extension of the arm at the shoulder region. So damage to the axillary nerve means the loss of function of these fibers, and so loss of extension of the arm at the shoulder joint. So let's discuss about other muscles. Around the shoulder. Okay, so we have a group of muscle that we call them the rotator cuff. So this is musculotendinous. It's a musculotendinous cuff which is formed around the shoulder joint, which helps to stabilize the shoulder. So it is made up of four muscles. So we have the supraspinatus muscle, the infraspinatus muscle, the teres minor, and the subscapularis muscle. And we have a mnemonic to remind ourselves about these muscles. But a common mistake, I'll tell you, by students is to think this T stands for teres major. No, the T here stands for teres minor muscle. And I know some of you in exam will write the teres major instead of the teres minor as the part of the rotator cuff muscles. Alright, so the supraspinatus it takes its origin on the supraspinous fossa of the scapula, and then the infraspinatus is taking origin from the infraspinous fossa of the scapula. The teres minor muscle is originating on the middle part of the lateral border of the scapula, and then the other muscle, the subscapularis, is coming from the subscapular fossa, which is the anterior surface of the scapula. Okay, so this is the supraspinatus muscle. This one is the infraspinatus muscle. This one is the teres minor muscle. Remember, the word teres means round, so this muscle is the rounded muscle. Okay, so it's a rounded muscle. Minor because we have got also a major muscle. So this is the rounded major, this is the rounded minor. So the rounded minor, rounded major. And then we have another muscle is coming from the subscapular fossa, and this is subscapularis, as it's seen on it occupies the anterior surface of the scapula. So let's talk a little bit about the surface anatomy of the humerus, just to remind ourselves. We already discussed it. The humerus has got two tubercles. We have the greater tubercle and the lesser tubercle. So the lesser tubercle and the greater tubercle. The greater tubercle is a little bit, lateral or behind, or lateral or posterior. Okay, so when you flip, you turn around the humerus, you can see the greater tubercle. So the greater tubercle has got three parts. So it has got the superior facet, the middle facet, and the inferior facet. The superior facet, middle facet, and inferior facet. Okay, this is enough to continue with insertion of the rotator cuff muscles. So let's talk about the insertion of the rotator cuff muscle. All right, so the supraspinatus is coming from supraspinous fossa and comes to insert on the superior facet of the greater tubercle. the superior facet of the greater tubercle, okay? But it passes below the clavicle and the acromion process of the scapula. So this is the supraspinatus muscle. It comes from the supraspinatus fossa. It goes underneath the scapula, the acromion process of the scapula and the clavicle to insert on the superior facet of the greater tubercle. The superior facet of the greater tubercle. Okay, we have also the infraspinatus muscle, which is coming from infraspinatus fossa and is going to insert on the middle facet of the greater tubercle. So this is the infraspinatus muscle from the infraspinatus fossa to the middle facet of the greater tubercle. And then we have the teres minor muscle, which is coming from the middle part of the lateral part, the middle part of the lateral border of the scapula, and then it inserts itself on the inferior facet of the greater tubercle, So we can also so look at this one. So you can remember this insertion by this a picture here. So this is for supraspinatus, infraspinatus, teres minor, and the subscapularis muscle. Okay, this is the time to talk about the nerve innervation of the rotator cuff muscles. So we have a nerve here. This nerve is passing below this ligament. We talk about this ligament sometimes later, but this nerve is known as the suprascapular nerve, and it gives a branch here to supply the supraspinatus muscle, and then it passes below here to come to supply the infraspinatus muscle. So this nerve is known as the suprascapular nerve. Okay. So what are the muscles which are innervated by the suprascapular nerve? So these are the supraspinatus and the infraspinatus muscle. The supra and the infraspinatus muscle. Okay, we'll have this nerve here, which is known as the axillary nerve. And you should remember the axillary nerve was the nerve that was supplying the deltoid muscle. And so it passes here. Like I've said, it wraps around the surgical neck of the humerus, passes by the quadrangular space, together with this artery. We're gonna talk about it sometimes later, and then it supplies the deltoid muscle. But you can also see it gives a branch to supply the teres minor muscle. Okay, the teres minor muscle. All right, so this is to say the teres minor muscle is also being supplied by the axillary nerve. In other words, the axillary nerve will supply two muscles, and the first one will be the deltoid muscle, and the second one is the teres minor muscle. And then we'll have when we discuss the brachial plexus, we talk about this upper subscapular nerve and the lower subscapular nerve, and of course we also have the middle subscapular nerve. But the upper subscapular nerve will supply the subscapularis muscle. The lower subscapular nerve will supply the subscapularis muscle, but it also gives a branch that goes to supply this muscle, and this is the teres major muscle. I know we haven't discussed about the teres major yet at this point, but we will shortly. Okay, so we have also the middle subscapular nerve, which is also known as thoracodorsal nerve, that was going to supply this muscle, and this is latissimus dorsi muscle. Don't worry about it, because we are talking about the rotator cuff muscles at this point. Okay, so the subscapularis will be supplied by two nerves, and that's the upper subscapular nerve, this one, and the lower subscapular nerve, that way. Okay, now it's time to talk about the action of these muscles. So guys, remember, this is the supraspinatus. When it contracts, it's gonna pull the arm in this direction. And what is this movement? This is abduction. But the first 15 degrees of abduction. Guys, remember I've told you from 15 degrees to 90 degrees, the abduction is being taken care by the deltoid muscle. But for the first 15 degrees is by the supraspinatus muscle. Okay, the second muscle here, the infraspinatus when it contracts, it's gonna pull the humerus into posterior, and like laterally rotate the posterior, laterally rotate the humerus, and so that is lateral rotation. But same applies for the teres minor muscle. It is found on the posterior surface, so when it contracts, it's gonna pull the humerus laterally, so it also contributes to lateral rotation of the humerus at the shoulder joint. Lateral rotation of the humerus at the shoulder joint. Okay, so we also have another muscle here, which is the subscapularis muscle. So this is the subscapularis muscle. So the subscapularis muscle is found anterior, so on the anterior surface of the scapula, and it inserts on the anterior surface of the humerus. Okay, so when it contracts, it pulls the humerus in this direction, and this is the medial. That's the medial rotation of the scapula, medial rotation of the humerus at the shoulder joint. Medial rotation of the humerus at the shoulder joint. Alright, but together, all these muscles together, they help to stabilize the shoulder joint. As I've told you, they help to keep the head of the humerus exactly where it needs to be. So the head of the humerus needs to be somewhere here to form the joint with glenoid fossa to form the ball and socket joint. So these muscles, they help this head of the humerus to be stabilized against the heel. So the last muscle in the intrinsic shoulder muscles is the teres major muscle. I've told you the meaning of teres is rounded, so this is a rounded muscle, but it's a major because we've seen the minor muscle, and this is the major. This is the teres major muscle. The teres major muscle is taking origin just below the origin of the teres minor muscle. Okay, so it takes origin from the posterior surface of the inferior angle of the scapula, posterior surface of the inferior angle of the scapula, but not at the tip of the angle. Okay, because at the tip of the angle, it is where the latissimus dorsi muscle originating. Like part of the latissimus dorsi muscle is originating from the inferior angle of the scapula. We have already discussed it somewhere else. Okay, so the teres major muscle is taking origin somewhere here, and is going to insert on the anterior surface of the humerus. So it's coming from posterior, as you can see. It's coming from posterior, but it is finding its way into the anterior surface of the humerus to come to insert on the medial rib of the intertubercular sulcus. Guys, remember, I told you we have the intertubercular sulcus, and it has got two ribs. It has the medial rib of the intertubercular sulcus and the lateral rib of the intertubercular sulcus. At the floor of the intertubercular sulcus, we saw that it is latissimus dorsi muscle that inserts itself. Okay, so the latissimus dorsi muscle inserts itself at the floor of the intertubercular groove, but on the medial rib of the intertubercular groove is where the teres major muscle inserts itself. Okay, so we have a famous mnemonic. Remember, this is the teres major muscle. This is the latissimus dorsi muscle, and then on the lateral surface, we shall see sometimes later, is where the pectoralis major muscle inserts itself. So we have two major muscles, the teres major and the pectoralis major, that are between putting the latissimus dorsi in between. So for this reason, we call this relationship a lady between two major. Lady for L for latissimus, between two major, which is the pectoralis major on the lateral side and the teres major on the medial side. We're gonna emphasize this sometimes later. So what about innervation of the teres major muscle? We've just seen the lower subscapular nerve, apart from supplying the subscapular muscle, it also gives a branch to the teres major muscle. So that's the lower subscapular nerve. And lastly, what's the action of the teres major muscle? Okay, the teres major muscle, see, it's coming from the posterior surface, and then it comes on anterior surface. So when it contracts, number one, it's gonna medially rotate the arm at the shoulder joint, because it pulls this in this direction, pulls it towards that direction. So that is medial rotation of the arm at the shoulder joint, but also it pulls this arm towards the body, so it adducts. So adduction and the medial rotation of the arm at the shoulder joint. Remember, don't forget to say the shoulder joint, because all the movements are happening at the shoulder joint. So guys, that is it from today's discussion, the intrinsic shoulder muscles. So don't forget to subscribe and share this video to your friends. But we'll have the TikTok and Instagram accounts. You can just follow the NeuroSketch with Dr. Kenny. Stay tuned. We'll have some quiz sometimes later, and stay tuned for more videos to come, and see you next time.